Great. So today's session, titled From Guesswork to Precision, Rethinking Member Engagement in a Data-Driven World, is brought to us by mPulse, as you can see. mPulse has been a longtime supporter and partner of both MHPA and our health plan members. I want to thank the entire mPulse team for pulling together today's session. With that, I'll go ahead and toss things over to Matt for introductions and today's content.
Thanks so much, Eric. Hi, everyone. My name is Matt Thompson. I'm a senior product manager at mPulse and really appreciate the opportunity to be speaking with you all today. Today, we're going to cover a packed agenda, really exciting topic. We're going to set the stage, first of all. We're going to talk about the challenge of organized chaos inside of member engagement. We're going to talk about how leading organizations are evolving their outreach practices and differentiating themselves. And ultimately, all of this is about building the foundation of member trust and activation. We'll give you actionable tools. We're going to be talking about 5 different levers you can pull to support intelligent engagement and through a distinct framework. And finally, we'll close with key takeaways and Q&A. And very, very honored to be joined by my colleague SriVani, who I'll pass it to.
Thanks, Matt. Hi, everyone. As Matt said, my name is SriVani Ganti. I am the Vice President of Member Engagement here at mPulse. And I, along with Matt, are going to provide strategies, tips, and hopefully some really thought-provoking considerations for how you can take the member engagement that you're currently doing it and really supercharge it with data and also, making it actionable without, spending and busting your budgets. All right, so why don't we first get started just to kind of set the stage of where we are right now. I think it's fair to say that all of our health plan friends are under a lot of pressure to improve member engagement while controlling costs and closing gaps in care. And we know it can be incredibly difficult because oftentimes we still have to rely upon really broad strategies that are not always the most efficient and can often drive up spend without necessarily delivering results. But this is where we're starting to see a fairly meaningful shift within leading organizations. So what does that look like? It looks like going from volume-based engagement to more precision-driven strategies using smarter targeting, actionable data, and outcome-oriented approaches. So today, what we're going to do is we designed this to be a conversation around practical and useful guidelines wherever you are in your organization's data journey, whether that means you are running predictive models or if you're only working with engagement data. So if you don't mind going to the next slide, Matt. What are we all trying to do? We all know everyone is essentially trying to do the right thing, but oftentimes things can go wrong because it's not exactly the most coordinated operation. Every single one of our own departments has the own distinct needs of either hitting different gaps and outcomes and goals. So for example, quality will always be chasing those gap closures. Mm-hmm. Finance is trying to look for areas where they can save on the budget. Operations wants to make sure we're compliant. And member experience is essentially trying to reduce abrasion. And none of these intentions are wrong, but when these efforts are run in parallel without coordination, the individual that ends up losing is the member. But then that will cost you organization in not only duplicate outreach, which is extremely expensive, but conflicting messages, which can really confuse a member, create abrasion, and really put you at a risk of higher opt-outs, which is a lot easier to do than it is to, coordinate that outreach and have a cohesive message. So we all know that there's no bad intention within this approach, but this organized chaos creates disorganized impact. And we know the pressure is coming from every direction. We know you don't always have the luxury to coordinate amongst your organization, and you're often mandated with just get it out. We often saw this happening during the pandemic when we were being extremely reactive to the messaging that was coming out to us and just having to get it out so we could remain that we're informing our members appropriately. So we know it's precision engagement isn't just a targeting problem, it's a coordination problem. And one thing I really hope you all consider and walk away with is it is really important to consider how are you building trust. And let's go into the next couple of slides where we can talk about the importance of trust and how it, creates member activation. On the next slide, as we noted, precision engagement isn't the problem as much as it's the coordination. Most of our organizations are sitting on a vast amount of data. The problem is, even within our own organizations, the data isn't speaking to each other, whether intentional or not. And the fact is, we do have to start thinking about appropriate governance models and interoperability, which I know is everyone's favorite buzzword, to actually think about how can we address this coordination problem. So thinking about member trust and activation, Matt and I were discussing this as we were prepping for the webinar, and something that he said that was, really important for all of us to consider is it is extremely easy to lose your members' trust in one message. You can not only lose their trust, but you can also have them opt out of all of your engagement programs in one fell swoop. And not only did you lose an opportunity to build that connection, but you lost trust. And that is a really important thing to take into consideration when you're trying to think about what is the distinct benefit of coordination within my organization. And this isn't just within your department. Again, it's going across different departments, across lines of business, really thinking about that 30,000-foot view. So trust is everything, right? It's important in our personal relationships, the brands we buy, and the arbiters of healthcare. We have to remember that members are consumers, and it's critical to think about how we're presenting our health plans to them. This is why that internal coordination is imperative. That's why avoiding the bombardment with multiple messages on the same topic from different departments is not the way to go. And that's where you want to take the opportunity to consolidate those programs. Think about the ways you can have clear calls to action, remove the barriers, and meet members where they are. So saying all of that, what are leading organizations doing differently? First, I think, in a time when everybody, again, is under significant budget constraints, we are often seeing a consolidation of vendors across organizations. But outside of that vendor consolidation, we're also seeing consolidation across organizations in terms of who is responsible for what, to force greater planning and also intentionality. But also, if I'm very honest, I know it's also a lot of folks having to sometimes have a growing book of responsibilities without necessarily having the same resources to address that. So you have to do a lot more with a lot less. And so when we're thinking about that, leading organizations are keeping this in mind. They're trying to see what is it that I can do to be a little bit more efficient, to help myself out, but also balance the burden between what my staff is doing, but also ensuring that we are having an ideal member experience, especially when it comes to engagement. Some examples are moving away from high volume IVR calls that often are just forcing to inform members, and organizations are really focusing on leveraging two-way SMS. This is similarly a lower cost means of connection, but it's just as scalable and often has better engagement rates, with a greater benefit of the fact that it actually is meeting members where they are. Medicaid members are on their smartphones, they are on their cell phones, and they would prefer to be reached out that way. Oftentimes that could be a primary computing device. So leveraging what's already in their pocket is important. I think we've all heard of folks from younger generations who have an absolute fear of picking up a phone, even when it's an automated call. So there's a distinct benefit to having these text message programs and these two-way conversations. And it's also very much possible to make them compliant. But in addition to that, while they're bidirectional intentional SMS, there has to be a lot of thoughtful content curation. They need to be focused, timely, actionable, and relevant. They shouldn't speak in abstracts of you may be due for an important screening. It needs to be focused on what are they due for? Why should they get this screening, and how can they schedule? When you have their attention in that moment, you need to make sure you give them everything they need to be successful. And again, it's very much possible to create these messages compliant with PHI and HIPAA, TCPA, and all of those regulations that are out there. And it's important for these organizations, as we're often seeing, to partner with or other fellow organizations and vendors who understand the nuance. And because of these types of partnerships and the desire to have more actionable, impactful outreach, we're also seeing stakeholders at these leading organizations often pushing back against legal and compliance, saying, hey, we have to do this outreach, and text is the way to go. We need to adopt quote unquote modern channels. And I know what you're thinking. SMS is not novel by any means. It's not a modern channel, but we know in healthcare, it's still considered it like that it is. And mPulse has been around for a while doing this, but it's still considered novel in some health plans. And so when you are starting to think about how can we revisit our member engagement approach across the organization, it behooves you, including compliance and legal, to leverage these cost-effective, scalable, desired digital and non-digital channels, such as SMS or even print, still has a very pertinent moment to create the critical connection with members, because meeting them where they're at, even when it's multi-channel, is not only checking the box of mandatory engagement, but it is also creating a better member experience. So what is our recommendation for all of you, and why are we here today for this webinar? We took a step back and we're thinking, what are ways that we can provide some tactical recommendations? And we came across and came up with this intelligent engagement framework. These 5 levers that are able to help you build member trust and activation and have that as a strong foundation. Now, if your plan is looking to get started, here is the recommendation. It's a way to take a step back and take a 30,000-foot view and take a tactile and predictable approach to designing your overall engagement framework. And it's important to note the intention behind this is these are the 5 steps you can take across departments, across programs, across areas of need, so it's predictable and repeatable. Now, obviously, step 1 is fairly straightforward. You want to plan. When available, where possible, try to plan out as far as you can what your engagement strategy is. When do you want to do those outreach topics and points? Something I've seen over the past decade is oftentimes I've seen plans really push for in Q4 to close as many HEDIS gaps as possible. And you want to say it makes sense, but you have to ask yourself, does it? Because the challenge is you're essentially asking your entire population in an area or a wide set of areas to all schedule an appointment around the same time. Now, the thing is, we know there are a finite number of providers, and that's shrinking. There's a finite number of appointments, and that's shrinking. So you come to a point where you've hit the saturation where you may not have all your members get the appointments that are needed for the calendar year. And that makes it really challenging when it comes to improving your scores. So consideration is, how can I pull ahead? How can I plan earlier? But then you're saying, SriVani, well, how will I know who to think about and target? And that brings us to the second lever of targeting. And this is where the data distinction and analysis is incredibly important. So sometimes you want to be asking yourself, if I want to plan earlier for my outreach, how can I be more thoughtful and intentful in terms of how I'm reaching out to folks? Well, how do you want to connect with them, right? Who are my most at-risk people within my population? I should reach out to them earlier, and maybe I should consider direct live calls. Okay, here are the group of people that's a vast majority. They're not super high risk. They are due, they aren't overdue. So maybe we should consider digital scalable SMS outreach. And then you want to dissect your population like that. So then you have intentional targeting to ensure that you're connecting with them at the right time, but also giving your organization a fair chance to actually hit those goals and measurements that you're looking for in that year. And that brings you to design, which is the third lever. As I was noting, it's really important for your design to have clear intentionality. So this isn't only behind what is the data that is being used to feed the framework, to feed the programs, to determine how we dissect the population, but also what channel mix is the right mix? What are we saying to these individuals? And that's where it's really critical to think about, how are you centering the member in order to address their needs and barriers so the messaging resonates with them and they take the action that you're looking for. And before you deploy any of this, you do want to consider, what is my measurement? What am I trying to gain out of this? Now, is it for me to see increased gap closure? Sure. But are there any other fringe ideas that might be coming out of it of, oh, we want to see an increase of link clicks to this educational resource? Or, oh, we want to see a reduction in calls to the call center because of confusion around messaging. Whatever it might be, as you're thinking about your targeting and design, make sure those measurements are built in, because when you come to the final lever, you want to ensure that you know how you performed, so then you can determine where you want to reinvest within your organization for future engagement. The whole point of this is to help you address the cost barriers that you may be facing as an organization, so you can spend smarter and not go into the red. And that's a really critical path. So before I hand it over to Matt, I want to just talk a little bit more about the first lever, which is planning. Now, as I mentioned before, it's really important to think about what is the problem my member is facing and not just the gap of the measure. With HEDIS, it's fairly defined. We know what we need them to do, but there comes the greater nuance of what is it that my member needs in order to achieve this. With cancer screenings, there are a lot of perceptions, beliefs, and fears that we know across communities, across cultures, across geographies that should really be taken into consideration. If you're in a rural environment, there's a high chance there could be a significant lack of screening centers in that area. And if that's the case, then how do you provide an appropriate resource and support in order to address that? Or if you are in a heavily urban environment that has a high density of certain immigrant populations with specific beliefs around visiting the doctors or specific beliefs around, modesty, how do you provide alternate solutions? When you think about the member or member cohorts in this way, it gives you a lot of information and data that is outside of just the analytics piece we're going to talk about shortly that can give you better precision with your programming. And with that, when you have just a general consideration of your member population and what their problems are, how does your data support that? What data do you have that can help address that? One example I can say is that, hey, we might not have this information, but how do I solve this? Is we know a lot of times with SDOH, there's a lot of needs for different resourcing and support. And sometimes plans just simply don't have their own internal resources to support that. So that's why thinking about, pointing members to resources like Find Help can be really powerful because sure, it's not directly connected into the plan per se, but it's still something out there that the member can look to. And so even if you may not have it, there could be an opportunity to find another strategic way to solve the problem for the member gap. And then, of course, again, we have to emphasize, make sure you have your KPIs, understand what your leading indicators are before you're running the program, and make sure you understand what your measurement plan is up front so you can set yourself up for success. So with that, I'm going to turn it over to Matt, who's going to provide a lot more context around the data measurement piece and how this can all come together for your organization through the next set of levers.
Thank you so much, SriVani. So we're going to go through a pretty straightforward example, but I want to encourage you to understand that whatever your level of data maturity is inside of your organization, you can always follow this type of framework, these types of steps. And what really matters is that as you progress in your data maturity model, that these only get more and more impactful. And so what's the strategy? Look at what data you have. There's always some level of signal from noise inside of your data. No matter if you have only access to enrollment data or only access to gaps in care, there's always something that you can identify and be thoughtful of saying, what is the most important signal for what is the outcome that I'm trying to achieve? Then once you have that view of your data, you can start to segment. What are different ways that we can identify based on these data that we have and categorize different members into different segments of people? Who should we be higher priority about reaching out to? Who are lower priority about reaching out to? And then once you actually better understand and have groupings of segments, you can actually personalize your outreach. This is changing the design, changing your cadence, changing your channel mix so that you can better communicate with the members who are within each of those segments. And ultimately, this is always about driving actual outcomes. And so in this particular example, where we're using a data signal, which is just an open gap for an eye exam patient with diabetes, we're able to start to identify different elements of high-risk segments that we could have high impact for. Sometimes even just within open gap data, you can look at prior years gap data. Is this somebody who closed their gap prior year and they're open now? Even that is somewhat of a signal that you can start to identify and build these segments around. And identifying people who are chronically non-compliant is a good example of ways to start this process of segmentation and ultimately getting them to actually book and get that care gap closed. So what does this look like before? Before you are outreaching based on volume. You're trying to get as many gaps closed as possible. You're reaching out to everybody who could qualify, and you're just keep continuously hitting everybody until at some point that number goes down. What this looks like in more precise member targeting is starting out and identifying who are the types of members who you expect to be compliant by the end of the year. Maybe not reach out to them that early. Both savings from the perspective of a actual total cost basis, but also from a member embrasion perspective. And then also thinking about what are different mixes that you can. Do you start high risk or do you start high intense outreach earlier with members who are non-compliant and high risk and start actually making those live calls early on in the year to avoid those sort of rushes for Q4 when appointments are even harder to get, or combining that with encouraging outreaches to members who were compliant last year, encouraging them to be compliant this year, either with SMS, email, or print. And so you can combine those different strategies based on the segmentation that you've already done, ultimately leading to less duplicative outreach, less conflicting messages, and higher levels of trust. So we're going to go into a little bit of a demo here. Before I start, I just wanted to highlight that all of this data is demo data. So these are not actual real people. So you don't have to worry even if the screen recording is actually happening. All right, so let me go ahead and share the screen. And what we're going to go through is sort of the process of what this looks like inside of Decision Point Insights. This is example of higher maturity for some of these organizations. What do I mean by higher maturity from a data perspective? Health plans are sending us their data. Usually this data is siloed, so different teams don't have access to the same level of data. And what we do is we take all that data, we bring it together. So that's one of the first things that you should be thinking about when you're trying to move upstream from your data maturity level is what are all the different data silos you have? Does medical claims exist separate from RX claims that exist separate from enrollment data, exist separate from call center data? All those different things are examples that work better together, and you can create a 360 degree of a member and get a better understanding of who they are and how you can connect with them by bringing those data together and what going through the process that we do, which is normalizing that data, enriching it with other data sources like census data, and then ultimately running predictive risk models against it. So we're not only identifying past behavior, but we're actually predicting future behavior. So some of the things that you can do inside Decision Point Insights with that data is identify for our prior eye exam gap. This is a high risk membership. And so with just one filter, we've gone down from 100% of the population down to 1% of the population, 145,000 members to 1,690 total members. Definitely something that would be within the ballpark of live call outreach for high risk members. And what does that mean for some other risk members? One of the things that I think is really interesting is that you still have 10,000 members who are low risk for eye exam, but depending on the time of the year, this is something where you might want to combine that with identification of are these members people who have had primary care visits in the last 12 months. Do you want to target these 95 members who are low risk for the eye exam, but looks like they're unengaged in actual health care and primary care in order to get them to a Drive to the Doctor campaign to support down the line overall reduction in your eye exam and gap closures? So this is all things that you can do to start to better identify what are the different types of data that you can be working with. Another thing that I strongly encourage, and we'll get to shortly, is what are the understandings that you could have about different insights from the population? So when you start to segment, you start to make sure that you have all these average sets. Average numbers of PCP visits across the broad population isn't really meaningful. But when you start to get down into these individual segments, understanding over the last 3 months, these members tend to be more engaged with their primary care. They tend to be higher number of chronic conditions. They tend to have a higher number of ED visits than your broader population. Obviously, diabetes type 2, most prevalent across this population, but understanding the connections between chronic pain, hypertensive disease. These are the types of insights that you can use to better understand and connect with this population, all before you actually begin your outreach. Other things that I think are really, really interesting of things you can do with enriched data sets are better understanding the different types of communities that you're working with, better understanding age breakdowns, and better understanding potential unmet social needs. In terms of program design, if you're working with a campaign and you're being tasked with getting uh, diabetic eye exam gap closures, you understand that there is a transportation barrier for uh, over half of your population. If you are not taking that into account, if you are not understanding that and designing your specific outreach to overcome these transportation barriers, you will at best get 50% results. And so I think when you start to think about it that way, if you're not looking at the data you have, you can only expect less and less efficacy because you have information about what are the likely barriers. Usually, members aren't non-compliant for no reason. There are reasons behind why they're non-compliant, and your job is to help understand what those are and to help them overcome them in order to lead to positive health outcomes. Oh, sorry. Actually, there was one more thing that I wanted to show you all, which was it's really, really great to be able to view this at a high level. But I want to say that I think some of the most effective uses of data have always been around an individual member. It's really, really important to make sure that you have that very high level perspective, have all the numbers, have all the prevalence rates behind you. But ultimately, we all have our stories. All of our members have stories, and getting down to an individual member and communicating their story, even if it's just to ideate around engagement design, getting down and understanding one person's experience. What is Kaylin's experience? What are the types of things that you would want to communicate to somebody who has social isolation issues, who has a behavioral health condition and a stigmatized medical condition, somebody who's had avoidable, preventable ED visits? How might you communicate with that person and how that might contrast with somebody who would be a little bit different, like Robin, whose primary language is Portuguese, who is older and just starting to age into potential fall risk? How you look at individual members is really, really helpful, both when you're trying to communicate the value of what you're trying to do to your own leadership teams and getting resources associated to make differences in these members' lives, but also when you're trying to come up with what the actual engagement design is for a particular program. All right. With that, I'm going to jump into the next lever, which is design. We already started to talk about this, but just wanted to make sure that we covered this. Risk-based segmentation, just any sort of segmentation in general, is a really, really significant aspect of creating your design. Making sure that you have different segmentations and that you're tailoring your content based on what you know about those individual members is first step on personalization. Making sure that you understand who you're connecting with and segmenting your content based on it. Next lever, channel mix. Think about what are the types of members who want to be called? Who are the types of members who want to engage more with SMS? Who are the ones that are going to involve better with print? Thinking about the different channel mix, combinations of channels is another really, really strong lever when you're thinking about plan design and matching that with your segmentation. Journey escalation. When you have a multi-channel design, you have the opportunity to escalate. So you can start with a print message. You can then lead to an email message. If they're still not having a gap closed, you can ultimately upgrade to SMS. Then you can finally get to live call outreach. All of these are cost-effective saving measures because what you're doing is based upon the interaction you're having with the member, based upon their actions, you're able to save and conserve resources and not use live calls for members who are only going to be able to have a gap closed or be able to solve a problem inside of an email, a print, or an SMS message. Personalization, making sure that your actual content design is relevant and changes based upon what you know about the member, changes it based on how they're interacting with your journey escalation, and making sure that you have the right timing and cadence for all of these. Making sure that There's blackout periods, making sure that you're blacking out certain times of the day, making sure that you're understanding the right time to connect with an individual member, what's the appropriate member of expectation you should have around when an SMS is initiated to when the follow-up message should occur, and even when a likely gap in closure is going to be carried. Based on certain network areas, you're never going to be able to close a certain gear cap within a week or within a month. And so making sure that you're being thoughtful about those types of time horizons for your members. Lastly is outreach calendar, making sure that you're prioritizing based upon your organizational requirements in order to reduce member abrasion. One of the biggest things that we've seen, and again, is a first step that any organization can do, is understand across a calendar period which are the most important times for the organization to do specific outreaches, and making sure that other parts of the organization have reduced ability to message those members is a really, really good way to make sure that you're starting anywhere, starting where you are, making sure that you're reducing member abrasion, even based on the calendar. All right, on to the next lever, which is measuring what matters. Traditional approach, you just think about total cost. How many members got how many numbers of outreaches, how many messages were sent. You add that all up and you get total cost. Very clear, understandable why people like to do it. Clear message, it aligns with the cost for an organization. If you're in a cost-constrained environment where there's risking pressures, total cost is always going to be part of it. What we've seen leading organizations do is take an approach where they are taking that total cost and actually looking to divide it by the outcomes achieved and looking at the cost per positive outcome. And so by taking not just the cost associated with a particular measure, but being able to tie that to actual clinical events, actual impact that you're having in that member's health outcome, and then ultimately using that as a proxy for what are the potential financial benefits, the potential benefits from a stars rating perspective, potential benefits to increase your ratings within the health plan network, or sorry, ecosystem that you're working with, so that you can increase your competitiveness. All of those types of things help you to better understand and have a view that even though something might cost a lot, on a cost per outcome basis, it's actually much cheaper than some of the other less efficient programs that we're working with. And we actually want to spend more, not less, in these certain areas that seem like we got to cut on these highly expensive resources. Um, some of the different ways that you can think about that, making sure that you're using leading indicators. Often, a lot times of these positive outcomes, they take a long time to actually be seen. Even if it's in claims lag, we know that that can bring months of lag in terms of what you're actually measuring. So one of the things that you should be doing is looking at your engagement rates, self-reported promotions, seeing if you can look at proxies such as number of calls received, number of grievances complained, number of ED visits, some of those things that you might have more readily available on a refresh basis that you can start to identify what are potential leading indicators towards what those positive outcomes are doing. Making sure you have some attribution methodology in practice. This can look like just closing down and saying for this particular week, we are sending this message, and then we're going to have a 90-day measurement period tied to that particular week so that you have the beginnings of understanding what was the message that was sent and then what was the actual outcome that occurred. Honestly, any sort of attribution method in practice, none of them are perfect. We live in a messy world. We live in a place where there's lots of different messages going around. So you're never going to be perfect, but the best organizations have not let perfect be the enemy of good. And we encourage you all to start where you are, start with even just having the conversations about attribution and starting small. Lastly, communicating upward. Some of the best ways that we've seen organizations do it is taking proactive communication and having, instead of having leadership communicate the need of doing ROI, having a more upward momentum where individual programs are talking about the ROI and the impact of their individual programs. Being able to say, these are the high level results, these are what we think is driving it, this is where we're going to dig deeper. Those sort of upward communications build the trust within your organization to let you take more significant risks and let you take those opportunities to potentially reinvest in different programs. And then focus on what drives results. I know this is a little bit of a difficult thing. We'll talk a little bit more on the next slide. But a program that is not performing, you can always identify ways that it can improve. And having programs that you cut, having programs that you say, this one is not working, we're going to not move away from this and we're going to start moving on another, is a great result. The only sort of difficulty or the only sort of loss I would say is around lost learning. When you didn't learn from a program, when you didn't have an insight into why something worked and what didn't work, that's really where you want to spend more of your time, is around learning, rather than focus on we got to make sure that we increase our number of programs or we increase the number of ones. Those aren't what always leads to the best outcomes. But if you get in the habit of continuous learning and being able to communicate those learnings to others inside of your organization, you're really moving up in terms of data maturity and then this intelligent engagement framework. Lastly, one of the really interesting things is what we call the reinvestment equation. When you do precision targeting, when you actually are able to decrease the number of members that you're reaching out to and having results in savings, it gives yourself options. Sure, you can pocket those savings and you could say, look, we found that we were sending duplicative messages. We were finding that we didn't really need to reach out to this many people, and we're going to just save those. That's great. That is a reasonable outcome, and that's one option that you have. But you have other options. You can go deeper. When you save money by choosing less and less members to send those outreaches to, you have the opportunity to take that same money that you save from not messaging those others and saying, can we go from a print campaign to a print and email campaign? Can we take this one-way SMS and go into a two-way SMS message? Do we have the opportunity to start to get live call resources associated with this just for this small number of members? When you have the opportunity to go deeper and more touch points in the smaller, more focused group, you can really turn up your ability to drive outcomes. One other example, which might sound a little bit odd, is go broader. What I mean by this is if you're focusing on very, very high risk members and you're using those high cost resources, if you're doing live call outreach, if you're moving into bidirectional SMS, you actually have the ability to go broader with some of those lower risk groups and send different messaging. You can send more focused drive to a doctor campaign for a high risk group, and you can send more broad-based positive nudges. Great job getting your gap closed last year. How can we help you get started on this next year on your journey? Because members, you're always rolling over, you're always basically starting back at zero, and you want to ensure that your members are being encouraged for the work that they are doing. And so you have an opportunity to go broader with lower cost channels by having some level of cost savings. And lastly, rebalance. Looking to take savings from one program that you decide is not really working and put it into a program, even if it is higher cost, if it's a lower cost per outcome basis, continuing to invest in those programs that drive results is a really, really great option for that's brought about by having this data-driven segmented targeting options. So lastly, we're going to talk about what it looks like to bring this all together. Talked about the framework. What does this look like in a future state? It wouldn't be a great webinar if you didn't talk about AI and the future. And so what we wanted to do is just give you a little bit of a preview of what this might look like. The real goal of this is that you understand that this framework, the tools might be changing. There might be AI brought into some of these places, but this process of planning, targeting, designing for your measures, measuring what matters, and reinvesting is not going away. So no matter what you do, if you start on this process, by the end, you might have advanced governance committees that are supporting real planning, having the perspective across the enterprise, having prioritized goals that reach all the way down across the organization, and having that baked in before you launch. You might, as part of your targeting, have AI resources that help you identify who are the right members to target based on the data that the AI is seeing. You might have generative AI helping you design, helping you understand what are potential communications, helping you run A/B experiments to help drive the best outcomes across different cohorts. You might have automation that supports actual measurement, making sure that you have these automated dashboards and automated closed loop attribution to get you to that perspective of measuring what really matters. And you might have AI performance driven and helping you identify what are uh, positive programs versus negative programs, which are ones that are growing, which is ones that are lagging and potentially deserve either reconsideration, changing, or reduction of investment. The tools will change, the tools and technology will always continue to evolve, but this framework, this process of starting a journey, planning, targeting, designing, measuring, and then reinvesting is not going to go away. And so we encourage all of you, wherever you are, whether you have access to these tools, um, the complicated systems, the highest performing groups never started that way. It always starts on a small journey, and those continuous steps that you make will ultimately lead to getting you further and further than you would if you just waited until you got everything perfect.
All right. So with that, we really hope that you have enjoyed what we've covered so far, and we're looking forward to answering your questions. But before we get into those, what are some of the key takeaways we would like you to come away with? Precision starts with planning, and governance is a key part of that. How are you looking at your organization's overall member engagement strategy? And how are you bringing your departments together to ensure that you don't have a cacophony of messages that are coming at your members, and making sure that they're coordinated? And because of that coordination, you have a strong opportunity to build trust, maintain trust, and get your members to be activated. And that is a key and core foundation to success. And regardless of the data that you have, whether we had mentioned it's predictive modeling or just, enrollment data, targeting with whatever you have is a really strong path forward. And also don't forget, like I had mentioned, that even where you are, the context of where your plan is serving, whether it's rural, suburban, urban, what is the concentration of different communities, that data can also help inform you. Just think outside the box, and it can be a huge opportunity to really personalize your messaging. And you want to take a strategic shift in how you're thinking about that return on investment. Instead of looking at this tactical cost per message, look at the cost per outcome, right? Because that outcome is really key to your business success. And think about precision savings to rebalance cost, reach, and results across your entire portfolio. And remember, technology amplifies a good process. It doesn't replace it. You still have to connect with the doers. Don't forget all of the people who are in your organizations who are chugging along day in and day out, who are getting it done. Working with them, talking to them, leaning on them to create smart processes and procedures is a way you can leverage technology, leverage AI to work smarter for you and just not make things up. So with that, we would love to open it up to question and answers. Thank you so much to MHPA and everyone here. Matt and I really enjoyed this, so we would love to see if there are any questions from the attendees.
And while I go ahead and do that, let me go ahead and see inside of the Q&A. Also, a couple quick reminders. This is one of the questions. Yes, the recording is going to be shared. It's going to be up on, I believe, Eric, correct me if I'm wrong, the MHPA YouTube channel, but it's also going to be sent out as at least the link to that will be shared. And then follow-up offer. We'll talk about this again at the end, but in terms of we would love to connect with all of you. If you have particular questions about how this might apply to your organization, stay on the lookout for emails from myself and from mPulse. Happy to schedule a data strategy session with you all and get you an understanding of wherever you are in your data journey, what are some of the things that you can do. It's always really helpful to actually have a real specific uh, case study to almost go through. What's a particular outreach that you're planning? What's a particular metric that you're trying to move, and kind of using that to help articulate how the framework kind of applies in practice, and would love to work with any of you all on that. All right. One other question that I'm seeing is, if you don't have predictive model, what's the best start where you are segmentation approach? So one of those ones that at least has come to mind for me is we walk through is care gaps So if you are starting with care gap data and you're being asked to close those care gaps, there is even some level of was this member compliant last year? And even those sorts of like year-to-year comparisons, I think is at least helpful and starting to identify, okay, these are members who are chronically compliant. These are members who are compliant now. Even to take that a step further, what it might look like. When did they close that gap? The most sophisticated that I've seen, which I thought was really, really cool analysis, was seeing what types of gaps are close together. So if you can start to bring together multiple gaps and you actually have that really inside of a calendar-based metric, starting to identify what gaps are closed together. And usually they're correlated with a finally getting into an established care relationship. So finally closing a gap in care around a provider and that provider connecting them and saying, all right, we're going to get these 3 labs all taken care of in a week in a particular day. That's an example of kind of moving up, even just with care gap data. Were they compliant last year? What are other care gaps? When did they close the gaps? That's an example of kind of how you can start to move up that data maturity, even inside of just a pretty specific silo.
And what I think is funny is hearing your answer. And I think what I'm going to share demonstrates how we fall into both of our respective areas. Because the way I would provide a recommendation for that is, looking at a care gap population, maybe let's talk about colorectal cancer screenings. And if you're not able to necessarily get the data on where they were in that gap, what if you, think about gender? We know that there are different behaviors based on gender on how people are active with their health, right? Males have a tendency to avoid healthcare, and females may be proactive with their healthcare, but they might still put it off because of familial obligations. And so that's another opportunity is like looking at the age. You're going to have date of birth, you're going to have gender. So those are two pieces that you will ultimately have that can be a point for consideration. And like I mentioned earlier, your geographic location is incredibly useful. So for something along the lines of diabetes screenings and management, a lot of times there's recommendations and suggestions for low impact activity. And one consideration is if my population is in a heavily urban area, but unfortunately it might have encountering a lot of crime, or if it's heavily policed, or if there's a lot of pollution, that might not be an appropriate recommendation to make to an individual in that area. And you may want to provide an alternate suggestion. So the thing is you can be very creative. And I think sometimes it can be great to take both approaches because you do want to move towards data maturity. So doing that analysis is critical, but then you also want to think about the personalization to build trust and activation. So you also want to see what those other little levers are that you might not be considering and can think outside of the box.
All right. One other question that just came in was around connecting the value of outreach, the value of effective design, the value of this targeting, and actually performing those outreach. And how do you connect that to not just the positive health outcomes, but also the broader value to a plan? And this is, I think, an interesting question when you talk about how do you take a gap in care closure and ultimately align that to either potential financial outcomes, mission-driven outcomes, member-driven outcomes. I think it depends. I would say probably my best advice on this is it's really, really easy to uh, go, uh, go too ambitious or too uh, uh, make your program seem like the most important that it is. And I would encourage you to have a level of humility and honesty and share the thinking, making sure that you're always sharing how you're getting to the results and how you're sharing those calculations. But a couple different things that you can think about. Usually, access to different members and ratings in different care will actually have direct corollary to financial performance, so incentive payments, making sure that you can start to identify what is a particular gap care closure resulting in from a rating or stars perspective is a good way to do it. making sure that you can start to identify how you're potentially competitively positioned. So how are you within the plan, and what might that look like to think about if you moved up in plan, how much your potential open enrollment would go up. So start to think about how you're positioned relative to other plans is another good way of doing it. But I would say the best advice that I would have around those would make sure that you're always showing your work and being honest, and having people have a trail through your calculations of saying, this is the assumption, and having a fruitful conversation around assumptions rather than people not really engaging because they are like, there's no way this is right. So having a good trail of assumptions is always, I find, very helpful. Okay.
I'm seeing this question here, Matt, and I feel like you might have started to touch on it, but there's an organization talking about how they're struggling to articulate the value behind calls, faxes, texts, and other outreach
Yep.
to help with the gap closure and thinking about KPIs and metrics. I think, maybe you want to go back to your calculation slide. I think,
Oh, yeah.
how do you look into how do you have your organization think about the cost per outcome, right? Yeah, the outcome achieved, right? And that positive outcome. And then I also think it's, each one of those has their own distinct benefit when you're also breaking down those individual channels. Costs and print can be some of the more expensive outreach, but things like digital, like SMS, IVR, and email can be significantly lower cost. And so it's about slicing and dicing. And almost, I think the other part of it is, instead of doing casting that wide net, is looking at those populations. So when you're talking about the gap closure, maybe for the focus on people who are they're continuously failing to close a gap. They are chronically overdue, 1 year, 2 years, whatever that might be. Maybe utilize your call resources there, because that tends to be a smaller part of the population. And then you have your middle group. That middle group might be people who are just recently due or maybe slightly overdue. You don't need to put your call resources there. And then when you start dissecting it based on the targeting, based on their risk, and then applying these channels based on what would be the most cost effective and most have potential to deliver that ROI, I think you can start articulating a better argument. And then also, one thing that I think is really, really critical, I want to emphasize, I know there are a lot of different platforms out there that can just automatically send out any message and do anything. And yes, that is quite brilliant. But the other thing to really fundamentally remember is your member engagement, your programming, your content needs to have intention. It has to have thoughtful design. It has to be easy to understand, clear, timely, actionable, relevant, and answer one, it's for what's in it for me. Don't just send out a text message that says, SriVani, you're due for a wellness screening. Cool, thank you. What? Who are you? Right? Be very intentional in your design. And then also, don't think one and done is going to solve it all, right? That's the other piece.
Yeah.
We've often seen it can sometimes take up to 3 touch points for a member to, indicate that they've closed that gap behavior. So intentional design is also going to be key as you think about when you're calculating the cost per outcome, which is why we say number of outreaches is not the way to go, because sometimes it's going to be a few, because humans are skeptical, people are skeptical when it comes to their healthcare, and we know it has not been made easy year over year. So again, how do we build trust through intentional design, intentional targeting? And then that allows us to create a more compelling argument for our leadership teams.
All right. Thank you, SriVani. Got all the way through my slides and went past my closer. Sorry, one moment. Lastly, just wanted to say thank you again to everyone. Someone was kind enough to ask about, who mPulse is. mPulse is a health experience and insights company. We are healthcare focused, healthcare experts. We only do healthcare, and we help you understand your data. We bring in disparate claims data, enrollment data, RX data, all different kinds of actual healthcare data. We take that in, we normalize it, we transform it, and we use predictive models to help you predict member behavior. Then we help you actually deliver great experiences through our Engage and Communicate product, which cover digital, SMS, IVR, as well as actual print communications. And lastly, we also actually develop member portals so that regardless of how your member is engaging with us, you're able to deliver a great experience and ultimately understand and help them achieve positive outcomes. With that, we'll happy to pass it back off to Eric to close out the session. Wanted to, again, stay tuned for communications from MHPA. Stay tuned for communications from mPulse. We would love to connect with you all and happy to dive deeper into these topics. They're things that SriVani and I really, really enjoy talking about with plans. And so happy to go deeper into your particular use case, your particular level of data maturity, and talk about how you can apply this framework.
Well, Matt did a great job covering pretty much everything I was going to say there. So I will just say thank you to Matt and SriVani for their time today. Obviously, member engagement is obviously a huge topic among our members all the time, and everyone's looking to improve. So we appreciate you guys sharing your expertise on how to leverage data, but also to implement frameworks that are effective. As Matt touched on, we did record the session. You can find it on MHA's YouTube channel. And then, like Matt said, there will be a couple follow-up outreaches. But if you have questions in the meantime, don't hesitate to reach out to me. I'd be happy to connect you to the mPulse team as well. So with that, I will thank everybody for joining us this afternoon, and we hope to see you on the next one. Thanks, everybody.